Robots helping doctors save lives. I have a quick question for you. What if I told you that in operating rooms all over the world right now, there's a machine with 4 arms, tiny wrist joints, and a 3D camera, helping doctors perform surgery? No, this isn't science fiction. It's happening today. And by the end of this, you're going to understand exactly how it works and why it might be one of the coolest examples of humans and technology teaming up that you'll ever learn about. Let's get into it. What even is robotic surgery? So here's the first thing you need to know. A robot is not doing surgery on its own. No robot is deciding to cut you open, thinking for itself, or making medical decisions. That part's still 100% human. Here's what's actually happening. A surgeon, a real trained human doctor, sits at a console a few feet away from you. In front of them is a screen showing a magnified, 3D, high-definition view of the inside of the patient's body. Their hands are resting on controls that look kind of like joysticks. Every single movement that surgeon makes with their hands gets translated instantly into movement in tiny robotic arms positioned over the patient. Those arms hold surgical instruments smaller than your pinky finger, instruments that can rotate and bend in ways human wrists actually can't. The most well-known machine that does this is called the Da Vinci surgical system, named after Leonardo da Vinci, the Renaissance artist and inventor, who was obsessed with the mechanics of the human body. Pretty fitting name, right? So think of it this way. It's less like a robot performing surgery, and more like a surgeon getting a superhero upgrade. Sharper eyes, steadier hands, and tools that can bend around corners a human hand never could. Why does this even matter? Okay, so why go through all this trouble? Why not just have the surgeon operate with their own hands like always? Here's the answer, and it comes down to one key idea: minimally invasive surgery. Let's break that phrase down. Invasive means how much the body has to be opened up. Traditional surgery often needs a large incision, a long cut, so the surgeon can see and reach everything with their hands. But a robotic system only needs a few tiny cuts, sometimes less than a centimeter long, just big enough for those slim robotic instruments and a camera to slip through. Why does that matter to the patient? A few big reasons. Reason 1. Smaller cuts mean less pain after surgery. Reason 2. Smaller cuts mean less blood loss during surgery. Reason 3. Smaller cuts mean a much lower chance of infection. Reason 4. Patients often go home from the hospital faster and get back to their normal lives sooner. Reason 5. And because the camera provides a magnified 3D view, the surgeon can actually see tiny structures, nerves, blood vessels, more clearly than the human eye alone could manage. Plus, those robotic wrists can rotate a full 360 degrees in some directions. Try rotating your own wrist like that. You can't, but the instrument can. That gives surgeons access to tight, awkward spaces inside the body that would otherwise be really hard to reach. Now here's a question worth really thinking about. Is robotic surgery just better than traditional surgery? Full stop. Not exactly. It's more nuanced than that. And that nuance is actually the interesting part. What humans bring: judgment, adaptability, and experience. A human surgeon can feel tissue with their own hands, respond instantly to something unexpected, and draw on years of training and instinct. What the robotic system brings: precision, stability, and access. The system filters out natural hand tremor, so if the surgeon's hand shakes even slightly, the instrument doesn't. It can scale down movements, meaning a large motion of the surgeon's hand becomes a tiny, precise motion at the instrument tip. And it can reach small, tucked-away spaces, through incisions a human hand could never fit through. So here's the honest answer. It's not human versus robot, like a competition. It's human with robot as a partnership. The surgeon is still the brain making every decision. The system is the tool amplifying what that brain can do. Think of it like the difference between an artist painting with just their fingers versus painting with a fine-tipped brush. Same artist, same skill, but one tool allows for a level of precision the other simply can't match. What does the future look like? So where is this all heading? Researchers and engineers are working on systems that could eventually incorporate more advanced imaging so surgeons can see things like blood flow or even highlighted tumor tissue in real time. There's active research into haptic feedback, meaning future systems might let surgeons actually feel the tissue they're working on through the controls, something today's systems are still limited at. There's also growing interest in combining these systems with AI-assisted analysis. Not AI making decisions, but AI helping flag things, measure things, or guide a surgeon's attention to something worth double-checking. None of this replaces the surgeon. It's the same story from 100 years of medical history. Better tools, guided by human hands and human judgment, leading to better outcomes for patients. So next time you hear about a robot doing surgery, you'll know the real story. It's not a machine acting on its own. It's a skilled surgeon using an incredibly precise set of tools to help patients heal faster and safer than ever before. And who knows, maybe one of you watching this will be the engineer or the surgeon designing the next version of this technology. Thanks for learning with me today. Technology and humans teaming up.